Tú eres mi otro yo. Si te hago daño a ti, me hago daño a mí mismo. Si te amo y respeto, me amo y respeto yo. And the translation to that is, you are my other me. If I do harm to you, I do harm to myself. If I love you and respect you, I love and respect myself. I feel like this year has been really hard for a lot of people, a lot of families. The biggest one has just been getting their basic needs met, financially, with food, housing stability, work stability, just because of the impact of COVID has had on the employment rates. I am a big believer in children having choice on how therapy looks like, and they get to run their own session, so it's very child-centered. And so I try to provide that, especially because they've lost control a lot this year. So how can they regain control in just a little piece of time that they're with me? Even when I'm talking to students, I always give them that choice, like, do you want to speak in Spanish, English, Spanglish? I tell them that's my favorite language, just because it's part of being bilingual and being bicultural. And so that's kind of what gives me hope, that it's like, not only are we healing our client in the moment, but we're healing their past generations and their future generations, and imagining what a whole, happy, well child would look like.
Seeing their little faces on the computer screen kept me going when we weren't able to actually connect in person. Knowing that they were okay, laying eyes on them, being able to, connect with parents really helped me. I was more connected to some families than I have ever been. I may be a little biased, but I feel like the teachers and the staff in the schools love having us here. We've been able to expand into different schools, and they just love our presence, and we love being here. We love working together to support our students, and it's easier to relate and feel more comfortable sometimes talking to a therapist that looks like you or resembles your auntie or your uncle or your grandma. We get a lot of those comparisons, or people like, oh, that's my Kofi mom. They just feel more comfortable. A lot of people do. Some of our parents realized that they needed services of their own during this time. So we were able to help provide a resource for them to start working on their mental health right alongside their children.
I think help is being able to offer something such as hope where people least expect it. Growing up in a small community that often lacked these resources, and seeing how it impacted families long term to have these issues unaddressed, what's a better way to give back to the community than something you never had growing up? Part of my role is also to help kids and parents learn how to hold space and how do we talk about difficult issues. I do a lot of that translation that helps parents and clients find a way to empathize with each other, to struggle together, right? And I think that helps build deeper relationships when they can do the healing together.
I'm a fourth grade Hmong-Do language teacher at Jackson Elementary. I have a student, he really needed a male role model, and he got very attached to Mr. Chang.
I like to believe that I'm in the business of selling hope. So when my clients and families can see someone that looks like them, speaks like them, and understands the cultural nuances without needing to ask, it creates a special kind of trust where I think it eliminates a lot of the barriers that creates, skepticism or hesitancy in seeking services.